Hi, everyone. Thanks for joining me today on this beautiful spring day, hopefully. We got snow here, so it's not so great in Chicago, but looking forward to the summer and getting out. I hope you guys grabbed your cup of tea and we're going to start our chai chat today. I am drinking some ginger and tulsi tea, and I love tulsi. It's very calming, and I always get a little nervous when I do these things. So thanks for joining us, me. And today I'm going to talk about my favorite topic in the world. I like talking about the gut. I really think that most of our patients who have chronic issues and chronic immune issues, a lot of the issues are kind of start in disruption of the microbiome. And I know a lot of you have heard me speak before, have heard me talk about stool, gut, the microbiome. And today we're going to talk about biofilms. And so before I get started, I just wanted to remind you all that I cannot give you medical advice. I'm here to try to give you some education, some understanding about these concepts, and these protocols that I'm going to talk to you about today, I have developed over the last 15 years. I started talking about biofilms in 2009, and since then developed different products and protocols. And so today I'm going to talk to you about some of the newer products that actually developed for True Healing Naturals, and I'm really excited about it. So I am going to start a little bit of a PowerPoint and then go through that, and then if you guys have some questions towards the end, send me your questions and I'm happy to kind of answer those. All right. So again, I'm going to talk to you about some of the products that I developed for True Healing Naturals. And my disclaimer again, I'm here to give you medical advice, not medical advice. I'm here to give you education, not medical advice. And if you are interested in some of these ideas and protocols or concepts, please talk to your medical practitioner. And if I'm your medical practitioner, please talk to me so we can determine what the best course of action is for you or your child. So again, biofilms and chronic infections. And the concept of this is this concept where many of my patients come back to me again and again with persistent infections. So we see a lot of things like persistent candida, recurrent strep infections, recurrent Clostridia infections, recurrent overgrowth of dysbiosis, and different things like that. And so this concept of, okay, so why is this patient getting infections over and over again? So the hypothesis is that many of us have chronic illnesses, and we think that these chronic illnesses and chronic inflammation is due to potential toxicity, exposure to toxins, exposure to frequent antibiotics, maybe poor dietary habits, and all these things, toxins, allergens, chemicals, our diet, antibiotics, they disrupt our microbiome. And that bacteria in our gut helps to develop our immune system. And disruption of this microbiome, especially early on in life, that occurs in a lot of my patients, causes an abnormal immune development and an abnormal immune response. And this abnormal immune response can lead to chronic inflammation and chronic issues in the gut, which lead to potential persistent issues with Clostridia, bacteria, fungus, and yeast. Now, these organisms can remain persistent in the gut because they produce pathogenic biofilms. And these pathogenic biofilms, I'll explain to you, protect these bacteria and yeast and parasites and viruses from destruction by the immune system. So the hypothesis is that early disruption of the microbiome causes disruption of the immune system, and toxicity and poor dietary choices can lead to the production of biofilms around these organisms so they can remain persistent in the body. So whenever we're dealing with issues like a chronic infection in the body, such as chronic sinusitis, otitis, pharyngitis, urinary tract infections, recurrent joint issues, and recurrent gut infections, we want to think about potential biofilms hiding these organisms. So what is biofilm? So I think of it as like a film, and you have all experienced this when you wake up in the morning and you feel that little bit of grit around your teeth. That is the bacteria in your mouth producing this film overnight. So what do you do to get rid of that? You brush your teeth and you feel that, it's cleaned up. Well, what happens when this bacteria is growing in your gut or your sinuses? How do you clear that out? And so we're going to talk a little bit about how to do that. But going back to this film, what is it made out of? Well, they call this film an extracellular polymeric substance. And it is like a mucousy water channel. And so this mucus layer grows over these bacteria and yeast. And the mucus layer allows this bacteria and yeast to grow without interference from the immune system. So when we think about mucus, what do we think? What is mucus made out of? Well, mucus is made out of carbohydrates. So that's why when you eat a lot of sugar or carbs, you get more mucusy. Well, mucus is negatively charged. And in order to hold this matrix together, we need some positively charged ions kind of dispersed in there. And the positively charged ions in this matrix are calcium, magnesium, and especially iron. So iron, calcium, and magnesium hold this together. So it's made out of mucus, sugar, and there's a little bit of fibrin or protein also in here. And it's all held together by calcium, iron, and some magnesium. And again, this matrix provides protection from the immune system, from dehydration, from antibiotics, from phagocytosis, from ultraviolet exposure. So these biofilms tend to grow in really toxic environments. I mean, they've found them on the space shuttle. You find them in very toxic waterways. And so it's a way for these organisms to survive in very, very harsh environments. Down here, if you can see, there's a beautiful pictures of what biofilms look like. You can kind of see these channels and how in the center is probably where these bacteria and the yeast are growing and hiding. And then they're protected by this beautiful biofilm. So we might want to consider these biofilm, pathogenic biofilm related type infections if we're dealing with chronic infections. So again, persistent recurrent dysbiosis, recurrent otitis, those patients who initially do well with antibiotics and antifungals, and then when you stop the antibiotics and antifungals, the infection comes back, or even patients who have had a history of needing frequent antibiotics because these bacteria need to evade the antibiotics and they learn to hide. Gingivitis, tonsillitis, dental caries. This is an area I think that is we don't talk a lot about the teeth. We don't talk a lot about the gingiva, but it's a place where infections can hide, especially strep infections. The patients who have had negative stool cultures, negative urine cultures, but when you place them on antibiotics, their symptoms improve. And so it's very hard to culture these bugs out. So if you do a throat culture, you won't see anything if they're hiding under biofilm. If you do a urine analysis and a urine culture, you won't culture out E. coli or a bacteria because, again, they're hiding under biofilm and you can't culture them out. So again, these are the patients that do well with antibiotics and antifungals, but when you stop antibiotics and antifungals, the symptoms come back. So what can we do to kind of control this biofilm that we don't want? We want to be able to kill these bugs so that the immune system can recover, our microbiome can recover. So over the years, these are some different strategies that have been talked about in the literature. And I'm going to talk to you guys about some of these, like probiotics and prebiotics. People don't realize the combination of probiotics and prebiotics is called a symbiotic. And just symbiotics can break down biofilms. So when you take a probiotic and you take a prebiotic, that also helps with biofilms. Disodium EDTA is one of my most favorite things to use. Again, this is a chelating substance. Taken orally, it does not get absorbed, but it pulls out the lead, the iron, the calcium, and magnesium from these biofilms. So it basically pokes holes in the biofilm. Now, other iron chelating compounds have also been talked about that, again, will pull that iron from the film, and then it allows that film to dissolve or get porous. Then we can use things like mucolytics or fibrinolytic enzymes. And these mucolytic and fibrinolytic enzymes can dissolve the biofilm. But again, we don't want to take a lot of these kinds of enzymes with food because then they'll dissolve the food and not dissolve the biofilm. And some of the issues around that is we want to make sure that these enzymes get to where they need to go. There's also chitosands that have been used for biofilm busting strategies, different surfactants. We're not going to talk about these in particular. And then what we call soft strategies. These soft strategies for breaking down biofilms can also be helpful when used in conjunction with some of the harder strategies. And again, depending on my patients, some patients can handle things, some patients can't, some patients are really sensitive. So the plant polyphenols are some nice like soft strategies of helping with biofilm. So I mentioned the prebiotic, the probiotic. I know you guys know a lot about probiotics, but just to kind of reiterate some of the prebiotic ideas. So when we talk about prebiotics, these are fiber. And many times they're soluble and sometimes insoluble fibers that when they're digested in the gut by probiotics, they produce something called short-chain fatty acids. Now, these short-chain fatty acids, in particular, one called butyrate, is extremely important for a healthy gut lining. These are the main fuel for a healthy gut. And so it's really important that we have the right balance of these short-chain fats, that we have enough butyrate, enough acetate, not too much propionate, and enough butyrate. So the balance of these is important. So there's different types of prebiotics, and they're usually these kind of sugar molecules. They're called oligosaccharides. And so there's fructo oligosaccharides, there's galacto oligosaccharides, mannan oligosaccharides, and then we have the insoluble and the soluble fiber that we mentioned. Lactulose, which is the drug, is also considered a prebiotic. And another one of my favorite prebiotics is PHGG, which is partially hydrolyzed guar gum. And so this one is particularly good for patients with constipation. Now, again, we don't want to use these prebiotics in just anybody at any time. They need to be used judiciously because, again, these are oligosaccharides, they're sugar molecules. And what do yeast and bacteria love? They love sugar. So we have a lot of dysbiosis, if we have a lot of issues with bacteria or yeast in the gut, we don't want to start here with a prebiotic. We want to clear that first and then go in with prebiotics. If we have a lot of problems with SIBO, then again, the fructo oligosaccharides are very difficult to tolerate. So I wanted to remind you about these really great prebiotics. And then I also wanted to mention something about probiotics. Again, Julie and I over at True Health Medical Center, we do a lot of work with small intestinal bacterial overgrowth, dysbiosis. And in the patients with SIBO, they don't necessarily do great with probiotics. Small intestinal bacterial overgrowth. So if we add more bacteria into the small intestine, we can sometimes aggravate the problem. So those types of patients do pretty well on what we call spore-forming bacteria. These bacteria are in spores, and what happens is when you eat them, they take a while to get into the digestive tract, and then they open lower down into the digestive tract. And when they open, they really help with things like lipopolysaccharide, which is a inflammatory byproduct of gram-negative bacteria. They help with things like reactive oxygen species. They have antioxidant effects. Some of them produce beta carotene. They degrade mucin, so they help with that mucus. And then they decrease some pro-inflammatory cytokines. So again, in this population, I do like these spore-forming bacteria. I mentioned EDTA. Now, sometimes we use calcium EDTA for detoxification of things like lead and aluminum. But in this particular instance, when we're talking about biofilm, we're talking about disodium EDTA. It's a quite large molecule, so most EDTA is not well absorbed at all. So this is mostly working in the gut or wherever it can go. So again, remember I told you about those biofilm communities being held together with iron, calcium, magnesium. They did this study with Staphylococcus. They couldn't kill the Staphylococcus biofilm with vancomycin, the medication that is used for things like MRSA, methicillin-resistant Staph aureus. But when EDTA was given with the antibiotic, they were able to kill the Staphylococcus. So that's just one example. Another example is this example in a rat model of aspergillosis. Now, many of our patients also have colonization of aspergillus in the GI tract potentially. And so aspergillus is becoming more and more of an issue for a lot of our patients that we're discovering. And it's hard to eradicate. But when you use something like EDTA along with an antifungal drug like itraconazole or Sporanox, that EDTA has an enhancing agent with the antifungal. And again, this enhancing agent is because these fungus, molds, yeast are growing under these films, and the EDTA is able to allow these antimicrobials to penetrate that film. So as I mentioned, there's some other biofilm controlling strategies, the enzymes, as well as these polyphenolic substances. So polyphenolic substances, you probably say, well, my child doesn't do well with phenols. Why would I use polyphenolic substances? And many of our patients have issues with phenols because they can't sulfate. The process of sulfation is weak. But again, if we can get some of the gut issues improved, then they can improve their issues with handling phenols. Plus, yeast is phenolic. A lot of the bacteria are phenolic, so the load of those add to our phenol load anyway. So again, using some of these substances judiciously for short periods of time, I've had good success with. So some of my favorite herbs for these types of infections are berberine, which is great for staph and strep, and yeast. Neem is great for strep and parasites. There's some polyphenolic oils that have antimicrobial effects. Many of you guys have heard of the Nemchek protocol, where he uses olive oil. Olive oil as a polyphenol helps to replenish some of that microbiome. Coconut oil can be very helpful too. And then we use a lot of essential oils. For this particular issue, these antimicrobial essential oils, my favorites are oregano, thyme, lemongrass. grapefruit seed as well. And then that concept of the natural iron chelating compounds. We talked about EDTA being a chelator that kind of pulls out iron from the biofilm, but there's natural things that can do that too. Apple cider vinegar, for instance, curcumin, green tea is a really good one. And then we're learning more and more about the use of bismuth for short periods of time as an kind of an iron chelating compound that potentially has good use in sulfur-based type SIBO. So I'm going to kind of go over this protocol with you guys. It's basically 4 steps. Step 1 is we want to just digest that film and kind of break it down and cause it to detach and kind of loosen its hold around that bacteria and yeast. And so the things that we can use for step 1 are the enzymes, the mucolytic enzymes, the fibrinolytic enzymes, the disaccharidases, the saccharadases, those types of enzymes. We can use disodium EDTA orally. We can use these iron chelators that I mentioned. Now, once we start poking holes and kind of loosen up that film and detach it or lyse it, we want to deal with what's underneath that film. And sometimes we really don't know because, again, as I mentioned, they're hard to culture. They're hard to figure out what's there. So if we use an antibiotic, for instance, say we use vancomycin for Clostridia. Say we use vancomycin for Clostridia. There's potentially other things that we're dealing with. So I'm not a huge fan of antibiotics unless we have to go there. I would prefer to use natural agents because natural agents have a wide variety of effects. They just don't hit one bug and then leave the other bugs kind of loose for the immune system to manage. So these antimicrobial herbs, antimicrobial essential oils are really nice to consider using. And I'll explain how I do that. And so step 3 is once we kind of loosen up this film, we deal with the bugs underneath the film. The bugs are releasing a lot of toxins, LPS, ammonia. They're releasing other potential inflammatory cells. And I have a theory that calcium, iron, and magnesium are not the only things that are holding this biofilm together. There might be other divalent cations holding the film together, like lead and aluminum or other heavy metals. So I think some of that's being released when we're kind of opening this stuff up. And so the term for that is a die-off reaction or a detox reaction. And so binders can be really helpful in step 3. And so using a variety of different types of binders for different types of cleanup can be really helpful in this protocol. It's one of the most important steps, I think. And then step 4 is we don't want to constantly kind of break down this mucus. We want our normal natural mucus. We need that. That normal natural mucus is called a glycocalyx. And we need that to kind of surround our mucous membranes so that they're kind of protected. So we need to restore that. And I think that diet is really important for this step 4. Fermented foods, a really good, healthy, clean diet. And then, of course, things like the right types of probiotics and the right types of prebiotics. So I'm going to talk to you about the products that I developed for these steps. And so you'll have an understanding of some of them. So step 1, that lysis and detachment, I tend to use these enzymes, like I mentioned. The mucolytic, the fibrinolytic. Xylanase is a really nice enzyme for things like staph and streptococcus as well. And serratiopeptidase, which is a fibrinolytic. It's from silkworm. If we're dealing with a lot of mucus, like in patients with Pseudomonas, again, these types of enzymes can be very helpful as well, like the serratiopeptidase and the xylanase. Then the EDTA can be used in this step 1. Sometimes we'll even use things like apple cider vinegar. A little bit of apple cider vinegar, like a teaspoon of apple cider vinegar with like a half a teaspoon of honey and about 4 ounces of water can also help to break down these little films, these biofilms. Weak organic acids in general can help with this. So even just ascorbic acid, citric acid are weak organic acids that can help with this. Lactoferrin is another one that's sometimes used for step 1. And then I mentioned like NAG or chitosan can also be used. And then these iron chelating compounds like curcumin, green tea, IP6. So the product, okay, before I go to that. So this lysis and detachment is best on an empty stomach. If you have severe gut issues and severe GI issues, again, please talk to your doctor, because many of the patients are extremely sensitive to any kind of enzyme. And we don't want to give these enzymes with iron, calcium, or magnesium because, again, they kind of help hold this film together. So if we're going to use iron, calcium, or magnesium, we have to use it away from these types of products. So the product I developed is called Mucosolve, and it's an enzyme product. It has disodium EDTA in it as well. It has the xylanase that I had mentioned and the serratiopeptidase, and then different saccharide-ases as well as some proteases. So this is a very nice enzyme to consider using for this particular step 1 in terms of lysis. So step 2 is using different antimicrobials to help clear the bacteria and yeast under the film. So again, I like to give step 1 first, maybe 30 minutes before a meal. Step 2, 15 minutes later on an empty stomach. Now, if that gets too hard to do, you can combine step 1 and step 2 at the same time, maybe 15 or 20 minutes before you eat, and then take the enzyme with the antimicrobial at the same time. Again, these antimicrobials should have kind of a nice wide net so that we're dealing with things like parasites and virus and bacteria and yeast all at the same time, because we don't know what's growing underneath this film. And then just with these antimicrobials, we have to be kind of cognizant for patients who have phenol issues or have oxalate issues because of the different substances that we might use to kill the bugs. So the product I developed as the antimicrobial is called Biosolve. And I'm really excited about this one because it is a combination of water-soluble herbs and fat-soluble essential oils. And the interesting thing about the fat-soluble essential oils in this product is that they're made into a powder. So they're actually powdered oils. So they don't taste oily or greasy, and you don't get that oily look or feel to them. So you don't have to like squeeze them out of a capsule. They're basically a powder. And so the fat-soluble powders and the water-soluble herbs working together to hit the different components of what we're trying to deal with, the water-soluble and deep. The oil powders can work to kind of penetrate some of the, the cellular structure of the cell walls of the different bacteria and yeast that we're dealing with as well. So the herbs that we have in here are neem, which I mentioned before, and berberine, which I mentioned before. And the oils we have in here are oil of oregano, thyme oil, lemongrass oil, and grapefruit seed oil. And they're held together with a little bit of a prebiotic, the tapioca maltodextrin. It's not the corn-based maltodextrin. So again, we're very cognizant about things like dairy, gluten, corn, soy. The enzymes, on the enzyme, it will say that it contains soy, but soy is used in the fermentation process, and the protein of the soy is really no longer left in this particular product. So it's extremely clean and extremely safe as well. So the Biosolve is our kind of a good way of like hitting what's underneath everything. And then step 3 is the binders. For True Healing Naturals, I haven't developed a product for binding yet. Again, I use different binding agents for different issues. And so again, I have listed here some of the different great binding agents. Now, when we're dealing with mycotoxins and different things like that, we use a lot of charcoal and clay. For these bacteria, things like modified citrus pectin works very well. Even things like chlorella, cilantro, parsley work very well. So yucca can work well, berber. So different patients have different affinities for different things. So again, trying different binding agents, see what works better for our patients. Some patients with constipation can't handle some of the things like the clays and the charcoals, but do okay on the pectins and the silicas or the zeolites. So again, it depends on the person, but I think it's an important piece to have a binding agent on board. And so usually we give step 3, the cleanup, about an hour after step 1 and 2. So take the enzymes, antimicrobials before the meal, take the cleanup agents or the binding agents about an hour after. And again, we don't want to do a lot of these binding agents with food because then they can kind of bind up some of the nutrition from the food. So one of the products in step 4 that we developed is a prebiotic type fiber. So step 4 is the, diet, diversity. I can't say that enough. Diversity in diet. And I know we have picky eaters out there, but use diverse herb choices, diverse spices, diverse oils. Try to do more of a plant-based diet versus animal-based diet. The plants have different types of fibers that, again, will feed different types of good bacteria in our gut. Even using things like going back to maybe using like some soy isoflavones in patients who can tolerate the soy. Using probiotics, prebiotics, green juicing, bone broths. I like collagen, fermented foods. And my patients who have these recurrent infections oftentimes are toxic. So we're dealing with a toxic body that ends up toxic liver, that ends up into the small intestines, creating SIBO and a lot of toxicity there. So these patients with recurrent infections really need some good detox protocols for various things. So let's not forget about that. So the prebiotic that I developed, it's called Prebiome Solve. It has some GOS from acacia, the PHGG or the partially hydrolyzed guar gum as well. A little bit of fenugreek, which is also a prebiotic, but also has some anti-inflammatory effects, and organic flax seeds, which kind of help, like, I kind of think of them as like a toothbrush, kind of cleaning up our bowels. And then the large arabinogalactan has kind of an immune modulatory effect. So anti-inflammatory, immune modulatory, prebiotic with a little bit of soluble and insoluble type fibers is very nice for restoration after we've done, usually I do like a 6-week protocol of the Mucosolve and the Biotisolve, and then follow that up with the prebiotics and probiotics. Now the probiotic that we have is called True Biospore. It is a spore forming type probiotic. So all spore formers start with bacillus. This has 4 different types of bacillus species, and it's in a fair amount. So there's 50 billion in a capsule. So there's a large amount of spore formers. And if you haven't used them before, you kind of want to go slow, like start slow and then build it up. But it's also a very nice product and well tolerated. So hopefully, let's see. Hopefully, yeah, there we go. Hopefully you guys have some idea of, what biofilms are, what are some of the reasons why we might worry about them, and then what are some of the tools that are out there that we can use to kind of help deal with this. If you guys have some questions, I can stay on a little longer. You can type me some questions, or, you know, many of you know where to find me. I'm at True Health Medical Center and or Pure Compounding Pharmacy. You can even send me a message on Facebook. I'm Doc Usman Singh. And please reach out and send us your questions. We'll be happy to answer them. So I think we got some questions here. And if you guys, some of you want to leave, welcome to leave. I will try to answer some of your questions if you have any here. So the question is, good bacteria also forms biofilms. Yes. So in the process of opening biofilms and killing pathogens, can we kill good bacteria too? You know, that's a great question, because our whole goal is to maintain our good bacteria. So as I mentioned, I've been working with this patient population since 2003. And again, when we use some of these natural antimicrobials judiciously, I really haven't seen overgrowth of Clostridia or overgrowth of yeast or something like that, because I'm using antimicrobial herbs. Again, we want to use these for short periods of time, like 6 weeks. And we are trying to hit the pathogenic biofilms, trying to replenish our good biofilm or glycocalyx, but it can get a little, you know, it can get a little tricky. So, you know, everything we do, we want to do judiciously. I really feel like, you know, this play between bacteria and oxalates is a big issue. And so some people believe if we kill the yeast and the bacteria, we help the oxalates. Other people believe by killing the yeast and bacteria, we make oxalates worse. And so I really feel like if we can get a hold of the balance, we are able to then balance the bacteria and the yeast and the oxalates and deal with them kind of simultaneously. So, you know, that's a really valid issue, but I really haven't seen that be a big problem over the years of me working with these types of infections. Can MB12 contribute to any biofilm? You know, I do have some patients when I give them B vitamins, and again, this is not from a scientific article, but when I give them B vitamins orally, so if I give them folinic acid, which I love to do, or I give them B6, they become more stimmy and hyper and worse. And so my thought process is there must be some interplay between some of these Bs and the bacteria and the yeast that I'm trying to deal with. So if I can clear some of the bacteria and yeast and then try to incorporate the Bs, I can do a better job. And I do end up having success that way. Sometimes I'll try leucovorin in some of our patients, and they'll kind of go really hyper and crazy, clean up the gut for about 6 weeks, do a good biofilm protocol, then reintroduce the folinic acid, and I have much better success. So I don't think that MB12 injections are going to really help affect biofilms, but I think, again, taking some of these Bs, in particular the ones I've had trouble with are folinic acid, B6. B1 seems to be just fine to tolerate. So do we stop calcium, magnesium, and iron while we're doing the protocol? If the patient really needs something like magnesium, I usually do it like in the evenings. I do think that if we could for about 4 to 6 weeks while we're really working on bugs, then it would be good to kind of keep them on hold. Hopefully, what can we expect after completing the biofilm protocol? Hopefully the load of that bacteria and the yeast and the recurrence of those infections diminishes. However, I do have some patients where, you know, we'll do a film protocol, we'll work on some toxicity, and we may have to do it again. So we've had some patients where they did really well on it, and so that we had to kind of nudge them through this over a few months. And then I think I'm going to just answer a couple more questions, and then we can be done. When do we take EDTA before Sporanox? So I know there's a lot of buzz about Sporanox, and I like using the Mucosolve and with it. So the Mucosolve again has the EDTA in it, plus the enzymes to break down that film. So you can take it 15 minutes before the Sporanox, or you can take it with the Sporanox. And again, talk to your doctor who prescribed the Sporanox, please. And I'm happy to talk to any of the doctors out there who, are interested if you want to know more about these protocols. I have lots of PowerPoints on this. Can we do biofilm protocols immediately after stem cells? Hopefully you've cleaned up the body, cleaned up the gut, done your detox before you've gone and done things like, stem cell treatment. So again, it depends. I mean, it really shouldn't affect the stem cells at all when you're kind of clearing up the gut. So I think we're out of time, but I really appreciate all of you being here today. I hope you get some time to, maybe look at some of the information that I have put out in the past over biofilms, and talk to your practitioners about these concepts. And if your practitioners want to talk to me, I'm happy to talk to them. So thank you all for chatting with me, and hopefully I'll get to see you soon and talk to you soon. Bye.